Hello, I'm Erin McClain, and this is Advocacy Beyond Earth Day, presenting my research insights into the intersection of pollution, public health, and socioeconomic status. This presentation was written for Honors Health Psychology with Dr. Deborah Conway at the Community College of Allegheny County. The questions researched were, what is the intersection between poverty, pollution, and public health? How can we do more to mitigate the detrimental effects of these combined factors? With an analysis of 3 types of pollution, air, soil, and groundwater, I explored how the effects of pollution intersected with poverty, impacting public health. Air pollution occurs when particulate matter, called aerosols, enter our air. Aerosols are hazardous for humans to inhale. They enter our breathing air primarily through exhaust from cars, trains, industrial and mining operations, and wildfires. As the climate continues to change, we're seeing increased wildfire events. Soil or land pollution is caused by hazardous and industrial waste, municipal sewage, construction and demolition debris, or mining operations. Individual instances of soil pollution come in the forms of littering or improper trash disposal, leaking pipes, chemicals from cars, salt, and other types of urban runoff. It can also be caused by air pollution. Since aerosols are particles heavier than air, they fall naturally to the ground and can pollute the soil. Polluted soil can also contaminate water on the surface and beneath the ground. Groundwater and surface water are not the same thing. Though surface water, such as lakes, rivers, and oceans, are also affected by contamination, it's groundwater pollution that's an unseen specter in the life cycle. 90 million people worldwide rely on groundwater as their primary source of water. Groundwater is supposed to be purified by the process of soaking into the ground and filtering through the soil to the water table below. But if the soil is polluted as the water makes its way down, the water pumped up through wells will likewise be contaminated. Underground aquifers from which groundwater is pumped are especially susceptible to pollution from per and polyfluoroalkyl substances, or PFAS, which are a fast-spreading chemical that's known to have ill effects on humans. PFAS were not classified as hazardous until 2016. Before then, chemicals from the PFAS family had many uses, from putting out jet fuel fires to being used in nonstick cookware. Simply stated, as air quality worsens, the mortality rate goes up. This quote is from a 2019 Washington Post article about the increase of air pollution. The article goes on to state that there was an estimated additional 10,000 deaths in 2018 that could be linked to increased air pollution from wildfires. This map shows air pollution levels by census tract. There are dark blue areas where there are high levels of air pollution, as there is in my own hometown of Pittsburgh, Pennsylvania. Other areas of heavy air pollution include many densely populated cities and the Mississippi River Valley. The River Valley has a large number of industrial facilities that utilize the river location and contribute to air pollution. Heavy industry has taken a toll on the air quality in the United States. What are the effects of these types of pollution on human health? Overall, pollution is dangerous for everyone's health. These 3 types of pollution are known to have the detrimental cumulative effects on the population, including the following diseases and conditions: asthma, decreased lung function, cardiopulmonary mortality, malaria, cholera, dementia, developmental and cognitive deficits, especially in children, and various types of cancer. This picture shows 2 children in a hospital for cancer treatment. An increased likelihood of childhood cancer can be linked to several types of pollution. From the study, mortality risk in fine particulate air pollution in a large representative cohort of US adults, it stated, quote, as expected, higher mortality risks were associated with lower income, marital status other than married, lower education, being underweight or obese, and smoking, end quote. This is a significant fact because the study shows that there's an increased health risk from the effects of air pollution combined with those of living in a lower socioeconomic status. Specifically, people who live in poverty have a higher risk of dying from the effects of pollution than the rest of the population. Further understanding of the intersection of public health risks from pollution and socioeconomic status can be derived by examining zip codes. Treating these conditions and the other ill effects of pollution are tied to the available services in a community. Where we live, our homes and neighborhoods, with some exceptions, are our biggest outward indicators of our socioeconomic status. Our zip code is a commonplace metric for compiling aggregate data about the shared traits of the people who live in a particular locality. Not only can it reveal commonalities between the people in a neighborhood, zip codes also determine what kind of municipal services are available to residents. School districts, educational and library services, hospitals, doctors and emergency medical services, police, firefighters, insurance, and voting districts are all determined in part by zip code. The way zip codes are used by corporations was noted in a piece from the St. Thomas Law Review in 2017. By knowing your home zip code, companies using big data can estimate with a high degree of certainty one's ethnic background, race, life expectancy, income status, economic condition, relationship status, and a plethora of other information that one would consider unique and private. On the right is a map of Chicago from a Time magazine article about life expectancy. The data is classified by zip code and shows that there's a difference in life expectancy by race, noting that the predominantly African American South Side has a much lower life expectancy than other areas of the map. This shows the utility of data by zip code, highlighting the disparity in life expectancy, but also the stratification of socioeconomic status by neighborhood or zip code. Wealthier neighborhoods like Chicago's Gold Coast on Lake Michigan and the surrounding areas boast the highest life expectancies on this map. Poverty has many facets. It can encompass everything from the lack of accessibility to the services determined by zip code, to food insecurity, or the inequity in the amount of actual energy available to households in lower socioeconomic neighborhoods. Fighting poverty means dismantling the causes of the intergenerational transfer of chronic poverty. These issues all pose their own threats in lower life expectancy, but when combined with the detrimental effects of pollution, they cause illness and death in disproportionate numbers. Delving further into the intersection of public health and location brought my research to environmental racism. Environmental racism is the practice of putting hazardous facilities in minority communities or those with a lower socioeconomic status. The data found in zip codes is also important for future community planning. Analysis of a zip code can determine whether or not the residents have the resources to block any unwanted construction, be it of an industrial or chemical manufacturing facility or even retail spaces. Hazardous facilities in minority communities clearly demonstrates intentional racism, wrote Ernest Bracy in his book, Why Environmental Solutions Especially Impact Minority People, the Racist Consequences of Climate Change. One of the places where this intentionality can be seen is in Anniston, Alabama, pictured on the left, where the Swan Chemical Company, later Monsanto, dumped PCB chemicals into the nearby waterways without proper remediation for over 4 decades. This majority African American community was investigated by 60 Minutes in 2002, who deemed it one of the most toxic cities in the country. The people of Anniston later won a lawsuit for their generational suffering, as noted by Harriet Washington in her 2019 book, A Terrible Thing to Waste: Environmental Racism and Its Assault on the American Mind. The intentional harm and lack of remediation in Anniston bears many similarities to the Flint water crisis. Flint, Michigan, another city with a large African American population, had the source of its water changed from the Lake Huron-fed Detroit River to the polluted Flint River in an effort to save the city money. The pollution from the river water corroded already out-of-date pipes and caused the leaching of lead and other heavy metals into the drinking water, which hasn't yet been officially remedied. To the right is a map from a 2017 analysis of the Flint water crisis, showing children under the age of 18 living in poverty in the Flint area. Poverty already plagued Flint before the water contamination, with multiple areas showing that greater than 75% of the children in that zip code lived in poverty. These children and their families now sit at the intersection of environmental racism, the intentional lack of remediation to their water crisis, pollution with lead and other heavy metals suffusing their drinking water, and the public health effects of this poisoning. There is no safe level for human lead consumption, according to the CDC. And in 1987, they declared abatement or removal the only safe option when dealing with environmental lead exposure. The same study recorded that there have been noticeable cognitive deficits in the children of Flint on standardized testing since the onset of their water crisis. In conclusion, we can take away several things from this intersectional study. Pollution has created a public health crisis for everyone, whether through wildfires, oil spills, or other catastrophic environmental events like the spread of PFAS chemicals into underground aquifers. There is a rise in deaths with contributing factors from pollution. Location and socioeconomic status are large factors in exposure to pollution and in the care received in preventing and combating the effects. We can see this in life expectancy data and the placement of hazardous facilities. Environmental racism plagues communities of color and those with lower socioeconomic status. The dangers of both poverty and pollution are multiplied by the lasting effects of the other. This deliberate placement of hazards and the lack of remediation for impoverished people multiplies the harm done by pollution. This leads to the last point that there is an increased mortality risk from pollution for people of color and those in a lower socioeconomic status. Jane Goodall said, what you do makes a difference, and you have to decide what kind of difference you want to make. When we're working to combat the problems presented by poverty, pollution, and public health, that means addressing the intersectionality of these issues. So how do we do that? Start with individual acts. While it may seem tiny, our own efforts to reduce, reuse, and recycle have a net positive effect for our environment and public health. Find out about local pollution and how it impacts your own health. This issue is at once both personal and global, but making a difference in our own homes and communities helps combat the larger issues. Local guide. Use a database like GuideStar to find local nonprofits that work towards pollution reduction efforts and area organizations that combat poverty. Every locality has nuanced issues, so ask local experts how you can best help. And collective action. There are groups that combat pollution as both a health crisis and a racial justice issue, like the World Resources Institute and the NAACP's Climate Justice Actions. They address the intersectionality of race, poverty, and pollution. They work to educate and make change on a larger scale and are useful informational resources to start the conversation about environmental racism and public health in your hometown. Remember that for our future and our health, no positive action is too small for a starting step. Thank you.